In the fight against breast cancer, early diagnosis is our strongest ally. Early detection means more treatment options, better outcomes, and more lives saved. But in order to catch cancer in its earliest stages, we must first be able to find it.
Screening mammography saves lives because we're able to find cancers before a patient feels that cancer. And when that happens, those cancers are smaller and are better treated. Breast cancers can be very hard to find. It's like a needle in a haystack. But 3D mammography allows us to look through the breast tissue in multiple image slices. So a 2D mammogram would be one image, but a 3D mammogram would have 50 images that allows us to look more closely at the breast tissue. And that allows us to find these small cancers.
What's most encouraging is that if breast cancer is caught at an early stage, it's possible that it can be treated without the need for surgery. Instead, a minimally invasive technique called cryoablation can be done as an outpatient procedure with incredible outcomes.
Cryoablation could be used to treat a lot of different breast cancers, but the ideal candidate would be someone that has an early stage, low-risk breast cancer. And it's particularly useful in women who have some reason for either wanting to or needing to avoid surgery. It's an office-based procedure where we place a small needle into the tumor and freeze it. It's great because it only requires local anesthesia, and it's virtually painless. The procedure takes only about 45 minutes at a time, and patients leave with a Band-Aid. So we're able to treat breast cancer without surgery, and they can resume normal activities right away.
It was just really unbelievable. You could feel a needle, and that was really it. When I left, I felt fine, and we went out to dinner. And I don't have a scar, nothing. Everything is perfect. The prognosis was good, and I've been fine ever since. Dr. Ward, he's my hero.
Cutting-edge diagnostic imaging technology and the latest treatment options go hand in hand with favorable outcomes, helping more patients stay ahead of the curve in the fight against breast cancer.
At REMI, we always and will continue to invest in the newest and latest technologies so that we can bring that world-class care to patients. We are currently the largest provider of 3D mammography services in the state, and we're probably one of the top 10 imaging providers across the country.
Advanced diagnostic imaging technology isn't the only thing Rhode Island Medical Imaging has invested in. The radiologists here are nationally recognized leaders because of the organization's belief that they can do so much more.
We want the brightest minds to be part of the REMI family, and people who are not only interested in providing care, but also developing that care and moving it forward, and usually results in a better outcome as well.
We recognize that breast imaging radiologists are more than just diagnosticians. We are breast physicians. And so it's really our job to put everything together, the results of their imaging test, their history of what their current problem is, their risk factors, what their family history is, and make sure that they're on the path to the right treatment.
At REMI, we're able to provide a comprehensive imaging service from the start of their journey through the end, from screenings to diagnostic imaging to ultrasound to biopsies to treatment and to follow-up. We do it in a warm and relaxing environment. The patient coming in to get medical imaging, obviously very anxiety-driven, so coming into an environment where it feels a little less sterile and a little bit warmer makes for a better experience and kind of makes you forget a little bit why you're there. But at the same time, we're providing the same level of care, if not better, than larger institutions, but in an environment that's very unique.
We have some of the best trained radiologists in the world, and we also invest in the best state-of-the-art equipment available on the market. And that combination allows us to find cancers early as they can be found. And when we find cancers early, we're actually able to treat them with minimally invasive techniques like cryoablation. And we've been doing this for quite some time now, and patients have done really well with the procedure, and the outcomes have been great.
Rhode Island Medical Imaging, world-class medical imaging, focusing on you. To find a location and schedule an appointment, visit rimirad.com/empowered today.